guys, well, what most of you all know about Kimberly Dixon is that I've had both of my knees replaced and that I've had 11 orthopedic surgeries in my lifetime. Well, what most of you do not know is that in 2017 in January I started experiencing issues with my hip. I remember in the fall of 2016 having my book signing, and at the end of it I told everyone that for the first time in my life there weren't any more surgeries in my immediate future. And although there still aren't any in my immediate future, at some point I'm going to need surgery on my hip. What we don't realize sometimes is when we're in pain, whether we have knee pain and we need to have something replaced, our body, we naturally compensate for pain by relying on our other parts. And that's why when so many people get their right knee replaced, eventually they need their left knee replaced as well, or vice versa. Because we are human, we're going to compensate for that pain by relying on parts that don't hurt as much. And in the meantime, we're doing damage because we're functioning in a way that our body was never intended to function. And I found out in 2002 that I needed to have my right knee replaced, but I was simply too young. I was 32 years old at the time. And so I waited for 12 years before I was able to get that surgery. And in the meantime, I was using my left leg, I was using my hip in improper ways, I was using my arms and shoulders in improper ways. So now I have pain in those parts of the body. Well, I got my knee replaced so I don't have knee pain, but now my hip is hurting. And my surgeon and I had discussed it at some point or another that I may have some hip issues. I knew it was a very real possibility. I was expecting it to be years down the road, not so soon. But in January of this year, my hip started feeling like I needed to pop it. And no matter what I did, whether I was stretching or doing yoga, it just had this sensation that it was stuck. So, you know, it's like, what's going on with my hip? And it didn't dawn on me. I just really wasn't thinking about it because it wasn't physically hurting at that point. But in February, I realized that my hip was hurting. And the day that I realized that my hip had been hurting for 3 straight days, I put my face in my hands and began to cry. But before I could even cry, I heard a voice say, "What are you crying for? You've been through worse pain than this." Which is absolutely true. My knee pain was a burning, raging, all-consuming, can't wrap your mind around it, kind of all-consuming pain where I felt like I couldn't see, I couldn't hear clearly. I actually became quite forgetful. A lot of the things that happened in my 30s, I don't have a real clear recollection of it. Just because I was in so much pain, my mind was just focusing on the moment, it was nothing else. And so my hip is not hurting like that. The hip pain that I'm experiencing is a low, dull pain, that's a constant ache. And if I have activity or if I stand too long, it will increasingly get worse until it does start to rage. But it's not that raging pain 24 hours a day the way my knee was. So I really began to think about that thing. Like, why are you so upset? You know how to handle pain. You've been in pain since you were a toddler. You know how to handle pain. Whether it's with hot baths and Epsom salt and essential oils and over-the-counter medications and tart cherry juice and turmeric and just different natural remedies that will reduce pain. I know those things. I know I can do pain in my sleep. Well, I did pain literally and figuratively. But it's something that I'm accustomed to, so I know how to handle it. I don't panic when something hurts. I spring into action. So I really began to think about why am I so upset about my hip hurting? And what I realized is not that the pain has nothing to do with the pain. It's that for the first time in my life, I feel like I'm standing on top of the mountain and I can see my future. I can see clearly no matter which direction I look in. And that's something I have never experienced before. Because most of my life has been spent in the valley, where it was so much confusion and drama and chaos going on that you couldn't see to the next minute, let alone into my future. It's like I didn't think about what life would look like when I was 60 or 70 years old because quite frankly it was too terrifying. My life at 35 was so bleak and so bad that I couldn't bear to think about what it was going to look like when I was 60 or 70. It was unimaginable. But for the first time now, I can look into the future and I see nothing but bright, sunshiny skies and just a a future that I never imagined. And the tears that day were because I'm afraid of giving that up. But here's what I realized. When you're on top of the mountain, you can see clearly because nothing grows there. If you're at a true summit, there aren't any trees up there. There aren't any flowers there. You can see the next mountain range and the next mountain peaks because there's nothing obstructing your view. Where in the valley, you have flowers, you have trees, you have shrubs. And all those things obstruct your view, but that's what they are all beautiful. And they're able to grow there because there is soil there that their roots can dig deep into. Well, because of the number of years that I've spent in the valley, I've got deep roots. And things may happen in life that make me bow down, that make me lean forward on my face, down on both knees, scratching and crawling in the dirt. But because I've got deep roots, don't nothing break me. I stand back up taller than what I stood before. And when you're in the valley, that's where all the growth occurs. That's where you learn things. That's where you acquire knowledge. And when you put that knowledge to use, then you have wisdom. You can't get that on top of the mountain because there's nothing there. There's no growth there. But in the valley, that's your opportunity. And oftentimes in life, we don't see those experiences, the quote-unquote bad experiences, as what they really are. They're your opportunity to shine. Because what can you learn from this experience? How can you use experience to help someone else? How can you use this experience to help yourself? And how can you use this experience to glorify God? So in my valley experiences, I've learned all those things. Because I know knee anatomy, and I know I could sit down with a surgeon and have a discussion about knee anatomy, and I sound like I'm a surgeon. I know so much about them. But I don't know anything about hips because I never had any issues with them. That was my area of focus. But just in the few months that I've been going back and forth to the doctor to get MRIs and to have follow-up appointments, I've started to learn an increasingly amount of things about hip anatomy. That it's a ball and socket joint. Well, I knew that, but that tomorrow I'm going to get an injection in my hip for the first time, where when you get an injection in your knee, they just stick it in because they know where the space is between your joint. But with the ball and socket joint, they can't do that. So they're going to do a guided CT in the radiology lab so that they know where to do the injection at, and they can put it in the right location. So all of those things, that's new to me. But just this week in the total joint replacement class that I go to just once a month to answer questions from a patient perspective, there was someone there who's having total hip replacement, and she and I were able to have an educated discussion about hips because I know something about hips now, whereas before my expertise was limited to knees. So I'm going to learn something from this experience that is going to put me in a position to be able to help even more people. And that's what this whole thing has been about, is helping others. Because when we're in our own mess, sometimes it's hard to see, what the benefit of this. How does this benefit me? But I promise you, there is a lesson in everything that we go through. And my life, I wouldn't change anything if I could go back and tweak anything, change anything. I wouldn't change the number of surgeries I've had, because with each surgery I learned something different that I could not have learned had I not had that surgery. So this experience is going to be different, because although I won't be standing at the mountaintop, I'm not going back to the pits of the valley that I was in before. Because you see, that woman that I was when I was 35 to 39 years old, she doesn't exist anymore. The woman that I am today, that's not who I was when I was 35. Not at all. It's like, so in this experience, I'm going to be looking and learning and listening in a way that I have never been able to do before. It's like, because I pay much more attention to the small things that are transpiring, and so that I can be transformed through this experience. So I'm going to have another mountaintop experience. It just won't be right now. I'm going to do what I need to do to make sure that I stay up on my feet. And I discussed that in detail with the surgeon on yesterday. And I told him, I'm a hiker. I'm an outdoor girl. I want to be outside. And I'm like, and I'm going to do everything I can to make sure that I can still go. You see my backpack is hanging right there. I don't ever put it up. So when somebody calls or an opportunity comes up for me to go hiking, I'm going. And you probably can't see it, but there's a tackle box sitting in the floor, because my dad gave me a fishing rod and a tackle box when I went to see him in May for his birthday. Because he's determined he's going to turn me into a fisherman. It's like, you're hiking and camping, you need to learn how to fish properly. So I have one of my dad's fishing rods now, and I'm going to fill up my tackle box this weekend because I'm going camping and hiking next week. So I'm not going to give up anything. I'm going to do whatever is absolutely necessary for me to continue to live the life that I've been living. And I'm not going to live in fear about what if this happens or what if that happens. What if something does happen? Well, I can tell you exactly what I'm going to do. I'm going to do whatever is necessary to make sure I live my best life. Not my neighbor's, not my sister's life, not my parents' life, but my best life. No matter what that looks like. And I won't compare it to what anybody else's life looks like, because their experiences are going to be different from mine. And the one thing that I know is I don't regret anything about my life. Nothing. Not from being so bow-legged that I couldn't walk. Because the one thing that I learned from that litty-bitty little girl, Pooh Bear. That's what my dad called me. That little girl, not this tall, that little baby that every time she took a step she fell. The one thing I learned from her is that when she falls, she gets back up. And when she gets back up, she is stronger than she's stronger than she was before. So I'm going to take this experience, I'm going to learn something from it, and I'm going to grow. And the roots that I have now, they are so deep, I can't imagine who I'm going to become through this experience. So I'm excited about it. I'm not excited about it. I am a little nervous about having the injection. I haven't had one before, but I'm confident in what the outcome will be. So guys, I just wanted to come to you for a minute. And it wasn't really necessarily about knee pain or hip pain. It's about life. When you're on top of the mountain, you can see clearly, but there's no growth up there. But when you're in the valley, look for the opportunities because they're there. We just don't always see them. Guys, I hope you have a great night. I love you. This is Coach Kimberly Dixon with Joyful Living with Kimberly Dixon. Follow me on YouTube, IG, or Instagram, Facebook, Twitter, on my WordPress blog. You can find me anywhere. Email me, call me. My email is coach@joyfullivingwithkimberlydixon.com. Wasn't thinking when I came up with that name, but that's what it is. Call me. My number is 919-977-3160. If you're having some pain or if you're feeling stuck in your life or you just want to know how to have some more joy in those difficult situations, give me a call. I'll be happy to share some of those things with you. Guys, good night, and I will talk to you soon.